Right, welcome to the first episode of the Crash Course series. I've basically decided to put this longer form content together in this series together in an attempt to educate the masses. And by educate the masses, I mean the five people that are probably going to watch this. Just an attempt to inform, educate, provide as much like actual factual information as possible on all things female health and physiology. Like full disclaimer, I am obviously not a medical professional. Look at the state of me. So everything that I say, please don't fucking go and don't think that I'm advising you on everything. Don't think that I'm telling you to go and do anything. I'm just providing as much factual information as I possibly can on the specific condition or topic that I'm going to be talking about in each video. I don't know if that is a fully legal disclaimer there, but you get the point, just to prevent any Karens or Susans from suing me. This series is going to be very sort of unedited, uncut, and raw. Okay, I'm just trying to provide as much education as possible in terms of like diagnosis, treatments, signs and symptoms, and living with these conditions. I'm obviously not speaking from a personal experience being a male, but what I am speaking from is just an informed and knowledgeable standpoint of experience working with over 100 different women that have lived with these conditions and still achieved incredible results with their physiques and with their health. So there is a certain element of experience in that sense, I guess. The first episode today I'm going to be talking about is PCOS. The reason being is because it's a weird one. Not only is it the most common disorder within women of reproductive age anyway, it's also the most commonly misdiagnosed disorder within women. So it's definitely worth getting into that topic first, I would say. So what is PCOS? PCOS is Polycystic Ovary Syndrome, which is a endocrine and metabolic disorder within women of reproductive age, which is a very overly wanky way of just saying it's the most common hormonal imbalance within women of reproductive age. Sorry. Okay. Now, before we get into what causes PCOS, signs and symptoms, treatment, etc., 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 what's going on physiologically, it's beneficial to get a better understanding of what polycystic ovaries actually are. So polycystic ovaries basically contain a large number of harmless follicles, which are about 8 millimeters roughly in size. These follicles are underdeveloped sacs, which eggs then grow inside of, okay? And with PCOS, the sacs often make it impossible basically for the ovaries to release an egg, okay? So this is why ovulation doesn't happen, and this is where irregular menstruation comes from. So these follicles are just underdeveloped sacs. Eggs start to grow inside of them. They then crowd around the eggs and the ovaries, preventing them from releasing, stopping ovulation from happening, and then stopping menstruation from happening as well at the same time. What causes PCOS is still to be unknown. There is no root cause yet to be found, unfortunately. It's shown to run within the family. So if your ma has PCOS, chances are you have it. Again, in terms of how to get a diagnosis and what criteria you need to meet, I'll be going through. But if a female in your family has PCOS, it's definitely worth getting checked. It's related to an abnormal amount of hormones basically being produced within the body. Okay, so excessive androgens, testosterone, DHT, but also insulin as well at the same time. And this is where the high level of insulin is where insulin resistance sort of comes from, which again, I'll be getting into. Now, the way that you need to get diagnosed for PCOS now is something called the Rotterdam criteria. Okay, so the way that this came about is you need to meet 2 of 3 criteria points. Basically, back in 2003, 5 PCOS experts got together. You could probably hazard a guess where in the world they were when they came up with this criteria. They got together in a room and said, right, lads, PCOS, they probably weren't lads, let's be honest. Gals, ladies, we need to come up with a more specific criteria to diagnose PCOS because it's heavily misdiagnosed. People are getting confused and misinformed. And the thing with PCOS is there's quite a long list of signs and symptoms that don't. Back then, before this Rotterdam criteria was created, you could have one of these signs or symptoms and be diagnosed with PCOS. and chances are it wasn't going to be PCOS. So they basically came together and said, right, what are the sort of three main signs and symptoms that are relevant to PCOS, where if you've got maybe sort of two or more of them, it's only going to be PCOS. So the three main features are irregular periods, excessive androgens, and polycystic ovaries. Okay, so if you meet two of these three criterias, you will be diagnosed with PCOS, but you have to meet two of the three. And in order to be diagnosed with two of those three things, you need two forms of testing. You need a blood test, or blood work, whatever terminology you want to use, basically to identify excessive androgens. Even though you might have things like the excessive hair growth in your upper lip, underneath your chin, arms, hands, on your arse, on your upper back, you might just be a hairy gal. Unfortunately, it doesn't necessarily mean increased androgens, or excessive androgens, should I say? So you need to get your blood work done to identify that, and you'll also need to get an ultrasound to identify polycystic ovaries. Okay, so irregular periods or non-existent periods, excessive androgens, and polycystic ovaries. You need two of those three things in order to get a diagnosis. Now, kind of going into different symptoms of PCOS and really what's going on physiologically to cause these signs and symptoms. So there is quite a long list, but I'm going to go through probably the more common ones and just give you a better explanation of what's going on within the body and maybe just some things that you can utilize that are going to help improve these things. It's definitely worth noting as well, PCOS, there is no cure for PCOS, but it is reversible. Okay, so what I mean by that is you can significantly reduce the signs and symptoms of PCOS, but it's always going to be there. Okay, so you can reverse the effects and you can live quite happily with PCOS, but you can't get rid of it. You can just get yourself to a point where it's not fucking your shit up or affecting your body in any kind of way, shape, or form. So I would guess the more common sort of sign or symptom is definitely irregular periods, just due to ovulation not happening. Again, this is where the follicles then become, the sacs form, the eggs grow inside the sacs, and they prevent the eggs of the ovaries from releasing, stopping ovulation, stopping menstruation, meaning irregular period or non-existent period. A difficulty getting pregnant. Now, this is obviously due to irregular or non-existent ovulation. It's definitely worth noting as well, PCOS does not mean you are going to have, it doesn't mean you're necessarily going to have issues falling pregnant. I've worked with countless women that have PCOS and can get pregnant, no problem, and have gotten pregnant, no problem, sorry. Again, it's one of these things where you might have difficulty with getting pregnant, and then through lifestyle modifications, which I'm going to go through, find things to be a little bit easier. There are also medications that you can go on to increase your chances as well at the same time. But again, as much as I am diving deeper into the topic of fertility, I'm not a fucking expert at this time being, so it's not something that I feel comfortable really speaking specifically about. All that I will say is that there are medications and processes you can go through if you have PCOS and you're looking to get pregnant to increase or improve your chances. Okay, you might also experience excessive hair growth. The reason being that with the excessive androgens, there's an increase in things like DHT, insulin, but also testosterone. Okay, and obviously testosterone being the primary male sex hormone that produces hair growth in certain areas, but you might experience it on your upper lip, underneath your chin, arms, hands, on your arse, on your back. There are things you can take for this. There's a topical cream, which I forget the name of. Vasq, I think is the name. I'll pop it up somewhere here on the screen. I did say I wasn't going to edit any fancy shit, but I will do that. There's also finasteride and aldactone as well, which can help. You might have a difficulty losing weight, which again, the rules of weight loss and fat loss still apply here. Okay, PCOS might make those rules harder to adhere to, but ultimately, like, calorie deficit is still relevant and it still applies. It might just be harder to follow and adhere to with PCOS. But again, I definitely think distribution of nutrition with PCOS is very relevant and very important, which I will get into very shortly in this video as well at the same time. You might experience thinning hair or hair loss altogether. The reason being is with that excessive androgens, there's also an increase in the hormone DHT. Okay. What happens with DHT? It goes to the scalp or the back of the head, the scalp, and then thins or shortens the hair follicles, and then eventually fucks them off altogether, and basically creates a balding area in that spot. Again, there are certain shampoos, creams, and medications that you can actually take that's going to help with this. I would say this is quite an extreme case with women with PCOS. Is typically the excessive hair growth that's quite commonly experienced, the hair thinning, maybe sometimes the hair balding, and the hair falling out altogether is quite an extreme and rare case, I would say. But again, there's medication, there's shampoos, there are things that you can take for that. And you might experience oily skin or acne. The reason being why is because, again, with that excessive androgens and an increase in testosterone, when there's an increase in testosterone, there's an oil in your skin that's produced called sebum, which then clogs pores, creates acne, that kind of thing. So it is only just a case of like, okay, there's an excessive androgens, there's an increase in testosterone, that's then triggering an oil called sebum in the skin, which is then causing acne, that kind of thing. Again, this is one of these things where I'm not a medical professional. I'm also not a skincare professional, okay? And you can probably tell by the fact I've got a face of a 40-year-old man when I'm only 29. But there are skincare protocols and treatments and shit that you can whap on that's going to wash that, well, more so than less, wash that oil off of your skin and heavily reduce the acne that you might be experiencing. And PCOS is also associated with type 2 diabetes and high cholesterol. The reason being why is because obviously you can be heavily insulin resistant. Your body's not utilizing insulin the same way that someone without PCOS would. Your brain's not really picking up on that. So it's kind of just producing a little bit more insulin to overcome this barrier, meaning that there's just a high level of sugar trapped within the blood that's not being used. Again, that doesn't necessarily, you might not have high blood sugar, doesn't mean it's anything to worry about. It's just something that if you're within a high range for a very extended period of time down the line, this can lead to high cholesterol, and it can ultimately lead to type 2 diabetes. So it's worth tracking your blood sugar levels. I would say 3 times a week, ideally fasted, just to see where that level markers are ending up. If you're consistently in a higher range, then this is where you need to make lifestyle modifications, more so importantly, nutritional changes, which I'm going to go through. So treating PCOS. Again, as I said, I'm not I'm not a medical professional. So everything that I say here is more so coming from a holistic lifestyle approach. The first thing that you should be looking at or addressing is your actual physique, and more so importantly, like your body fat levels. Okay. If you're someone who is overweight or you're obese, the very first thing that you should be looking at is losing a lot of weight. Okay, and I know that might be a bitter pill to swallow, and it's not a very sexy answer, but I can guarantee losing a shit heap of weight is going to make your body less insulin resistant. It's also going to help regulate your menstrual cycle just a little bit more. And every sort of sign symptom that you are experiencing with PCOS will just generally improve with that reduction in weight as well at the same time. What I will say as well is distribution of nutrients in terms of like how you actually distribute your nutrition on a day-to-day basis does matter with PCOS as well. For the average person, all you really need to look at is calories and protein. With someone with PCOS, you need to be looking at all 3 macros. You need to be looking at protein. You need to be looking at fats. You need to be looking at carbs and obviously calories as well at the same time. So a high protein diet that also follows high unsaturated fats and pretty low carbohydrates is typically what you should be doing, and utilizing your carbohydrates around your training window like the average person would, but roughly about 25 to 35% of your overall calories should be coming from complex carbs. So things like your oats, your rice, your potatoes, and avoiding simple carbs or refined carbs. Quote unquote, prioritizing the healthy carbs and ignoring the shit ones. And any carbs that you are intaking on a daily basis, you're putting around your training window. So pre and post workout, maybe even intra workout if you're using some kind of intra drink or anything like that. And then every other meal should be high protein, high unsaturated fats. We all know what protein sources are, but when I talk about high unsaturated fats, I'm talking about 90% dark chocolate, that kind of thing, avocado, nuts, nut butter, extra virgin olive oil. I would even say getting omega 3 fatty acids in. A few times a week at the bare minimum as well. So something like salmon is a fucking fantastic choice. High in fats, high in protein, and high in omega-3 fatty acids. So that's a winner. Supplementation, I think a very basic list that you should be following and getting in: magnesium. Any female should be getting that in, to be honest. Zinc, myonistinol, and a cod liver oil supplement as well. Any kind of omega-3 supplement is good. Cod liver oil is top tier one, though, for PCOS for sure. And again, high fiber, so lots of fruit, lots of veg, that kind of thing. But carbohydrates are typically the food groups that people are overeating on. So trying to drastically reduce that, 25 to 35% of your overall calories coming from those carbs, put it around your training window, and making sure they're quote unquote healthy carbs will definitely help with improving your symptoms, but also reducing that blood sugar levels as well at the same time. I wanted to keep this episode fairly vague and basic without getting into it all. I want to speak about PCOS in a sort of overview sense, okay? If you've enjoyed this episode and you want me to go into the specifics, i.e. the 4 different types of PCOS, what causes them, what's going on for the body, them, how to treat them, I'm more than happy to, but again, I'll be here all fucking day. So I wanted to keep this one very short and brief. If you like this episode and you want to see me do more with maybe endometriosis, menopause, just irregular menstruation, whatever the fuck it might be, please let me know. Like, comment, describe, all that good shit. And I will see you in the next episode.